Now joining Moira for our first conversation, the solver, putting women at the center of COVID-19 recovery, please welcome Melinda Gates, co-chair Bill and Melinda Gates Foundation, number 5 on this year's Forbes Power Women's list.
As we know, COVID has magnified every existing inequality and laid bare the systemic gaps that we've had, problems that have been century old and the like. But we also know that the pandemic has disproportionately impacted women in every way, from increased burden in terms of childcare, unpaid labor, the economic toll in the labor force and the like. In this dire time, there's a bit of a tendency to put these issues of gender on the back burner, or put them to the side. But you've been talking so much about the fact that if we want a faster recovery, we need to put these at the forefront, these conversations at the forefront of any discussion around recovery. Can you talk a little bit more about that and why that is so urgent right now?
I think, in the past, we always thought of this women's issue as the nice issue to do or the side issue. But now the pandemic has laid bare what our economy is built on the backs of. And our economies all over the world are built on the backs of women's unpaid labor. And now it is right here in our faces, in our homes. The moms trying to help keep their kids online, finding a place for childcare for their child so they can get on a bus and go to work, helping care for the elderly, get them their prescriptions, get them food right now. So if we're going to build back as quickly as we possibly can from COVID-19, we have to look at this fundamental issue of caregiving, because it is one of the things that holds women back from doing the productive work they sometimes want to do in society. And we know 1 in 4 women right now are reporting in the United States that they're going to downshift their careers. In September alone, 865,000 women dropped out of the workforce. So if we want to get women back in the workforce, we absolutely have to deal with this child care issue that is there. And now we finally get to see it. So we've got to do something about it.
There's these silver linings to the moment, and this moment in the sense that it brought these longstanding issues to the surface that people may have known about, but may not have necessarily appreciated just how consequential they are, and all the more so in this moment in time. I'd love for you to talk a little bit more about the broken caregiving system and the ways in which you think both the public and the private sector need to start thinking very, very quickly around solutions to move the needle forward, and some of the strategies and tactics that you've been talking about and proposing that we need to really focus on as a nation, but also thinking more broadly around the world.
So yeah, let's take it in 2 pieces. So the private sector, what can private sector leaders do? So first of all, I think we have this myth in the United States that a lot of women have paid family medical leave. No, in fact, it's less than 30% of women have paid family medical leave. So when a woman gives birth, can you imagine having a C-section and having literally some jobs no days off? So you cobble together a few vacation days. You've had a C-section, and we know it's good for you to breastfeed your baby. It's the best thing you can do. And yet you have to go back to work. That makes 0 sense. So the private sector can make sure we have good paid family medical leave policies. And when I say family medical leave policies, I don't mean just the woman. I mean the man too. In Sweden, the men for over 30 years have had, the whole society has had paid family medical leave. You talk to men in Sweden, they say, of course I take my time off. I care about my child. I want to get close to him or her. And guess what? If a dad takes time off at the beginning, he participates in rearing the child all the way through their life far more. So good paid family medical leave, flexible work hours, breastfeeding rooms for women when they come back to the workforce. In the government sector, again, making sure we have paid family medical leave policy. And what we're seeing with the stimulus packages right now is they are doing some paid sick days. They're looking at these childcare days. We need to move more money into the childcare sector because that sector has been devastated by COVID-19. So we need to also make sure that 800,000 elderly people who are on the Medicaid roll get pulled off and can actually go into quality elder care homes. So those are a lot of the issues we need to look at in the public sector piece of this.
So obviously, this is a problem that needs to be addressed holistically across the public and private sector. We know these issues exist. We know that there's potential policies that can catalyze an important change. What do you think are some of the biggest hurdles in actually moving this forward? What's some of the resistance that you're hearing in terms of the why we can't or shouldn't or aren't doing this, in spite of the urgent critical need to really address these right now?
Well, I think it would help. I know it helps when you have more women in leadership positions because they know what this burden looks like. There are lovely pieces of it we want to do. We care for the young, we care for the elderly, but there are also hard parts of it. And when you have more female leaders in Congress, in the Senate, in state houses, very good policies get passed. There are some fantastic policies now in about 8 different states. And there was lots of good, robust discussion around those, but it takes women, quite frankly, and enlightened men pushing these issues forward, or we won't say it's important for our society.
This year has created this moment where trends obviously that would have taken years to move forward have accelerated. You talk about the need to have more women in positions of power. When we think about the urgent need to tackle some of these issues, juxtaposed with sometimes the timeline it can take to put more women into positions of power, the pipelines to really grow to maturity. How do you think about what we can be doing in both the public and private sector right now, or how us as individuals can be pushing this agenda forward in a more rapid way so that we can start to see these changes manifest themselves that in a way that allows us for a faster recovery?
Right. I think so often we've talked about these pipelines and these leaky pipelines, but honestly, we use that as an excuse. We need to talk about pathways. There are lots of different ways to come into an industry. It's not just one way. And I'll give you one example, tech. I think we should all care a lot about tech. It is pervasive in our society. I just saw you on your cell phone texting right before we got on this, right? We all use tech. But we need to give women pathways in. Today, the number of computer science graduates has gone down since the time I was in college. And it's because it's not a very welcoming place to go into technology. And yet we know if you have that first freshman class done right at college, more women will go into it and more women will persist and stay. If you give women opportunities for great internships early on and they get used to the tech industry and they say, wow, it's more creative than I thought. It's not just about zeros and ones, then they stay in the tech industry. But there are a whole host of things we need to do in industry after industry to break down the barriers and to create multiple pathways in for women and people of color, quite frankly, as well.
How do you think, when you talk about what industries need to do, there's no silver bullet solution. And each industry has its own nuances and sets of challenges or opportunities to address these issues. How do you think industry leaders need to start thinking differently about these pathways? This year, obviously, has brought these conversations to the forefront. We've seen people taking a lot more steps and the public asking for more accountability to move the needle forward. But how do you think those in positions of power need to be thinking about this differently or prioritizing it on their agenda as we move into the new year?
Well, I would say this. What gets measured is what gets done. So if you're the CEO of a company, you can set it as an expectation for your employees and for your senior leaders and your senior managers to say, we are going to move the needle on this. Have transparency about how many women and people of color you have at all levels. Look at it repeatedly, measure it, go back to it, look at the progress, and hold your managers accountable. They can do this. We see it in company after company that once it's committed to, and it's committed to on a shorter time frame, not 30 years from now, but in the next 5 years, then companies start to figure this out. And what I know is it is actually doable. We just have to commit to it.
I wanted to switch gears a little bit and talk about COVID-19 and the vaccine efforts. And as we look at the world moving forward, obviously, you all have been sounding the alarm about infectious diseases for decades, far before coronavirus hit. And so much of your time, attention, and resources in the past many months have been focused not only accelerating finding these vaccines, but ensuring that they are deployed in a way that's most equitable. We all know that the more developed countries have already secured vaccines and have the more mature infrastructure to deploy and get them into the hands of people who need them the most. When you think about the pandemic on the global stage and where we are at this turning point and this exciting milestone in the development of vaccines, what are you most concerned about in ensuring that they have equitable distribution and that they don't continue, that the model for the rollout doesn't exacerbate already existing inequalities?
Yeah, thanks for that question, Moira, because this is fundamental question. I mean, who would have thought last March, if you remember where we were March 30th of last year, who would have thought we would have our first vaccine being rolled out in the UK right now, and that we'll soon have it in other high-income countries, including the United States? What we have to think about, though, are people in middle and low-income countries. And here's why. If we don't, we're going to see twice as much death, and we're going to also see a much slower recovery of all of our economies around the world. The Eurasia Group predicts that if, in fact, we start to take care of low and middle income countries, we'll add over $200 billion in the US economy in the next 5 years. So there's a huge opportunity that will help us bring back things like travel and supply chains like manufacturing. But if we let this disease continue to bounce around the world, even if it's not in our high income countries, it is going to be a very, very long time till we have global economy back up and running. And the US is going to suffer from it, as will Europe. So it's not only the right thing to do, it's the responsible thing to do.
Just because things are the right thing to do and the responsible thing to do doesn't mean they always get done. And right now with this pandemic, so many countries in many respects have turned inward to be able to tackle the disease and curb its devastating effects within their own borders. But obviously, if we don't address this on the global stage, as you said, everyone will suffer. What do you say to leaders who are continuing to obviously put focus within their own countries and their own people around this urgency to really begin to think differently across this on a global stage, and how they think differently about their resources and assets and power capital around this issue beyond just their own borders?
Well, luckily, there's been a group of very enlightened leaders who have come together in the last many months, who have done fundraising. Now, there's more needed to say, we do care about the rest of the world, and we do care about it for the right reasons and the responsible reasons. For any other government that hasn't done that and is looking just at their own, inside their own borders, I say to them, it's not sensible. You are going to have a much slower recovery. People aren't going to be able to travel out of your country or into your country. You're still going to have these manufacturing and supply chain issues that we're facing now. So your road in your own country to recovery is going to be much slower. So what you really should think about is, first, healthcare workers all over the world, because they are the ones keeping all of us safe and will continue to, so it doesn't bounce back into your country. And then you got to think about not only your own citizens, but citizens everywhere else.
Something I so admire about you, Melinda, and obviously your husband and the work that you both champion is that you have never shied away from solving literally the world's most challenging problems. You've also, though, talked throughout the course of your foundation around what you all have learned in terms of how to best problem solve. Can you share, as we all look to address some of these longstanding issues in our own communities, in our own countries, industries, and the like, can you share some of the lessons that you learned around how to better problem solve? What's been most effective in terms of the challenges we may see at hand, but actually moving that to actionable solutions that lead to meaningful progress?
Well, what we find is that you have to get all the right partners basically in consortium working together. I'll call it, you can't do it today in terms of physically, but everybody with a seat at the table looking at the problem. And so it takes a consortium of private sector, public sector, philanthropy, and civil society to hold everybody accountable. When you get that ecosystem working and working properly, you can tackle some of the hardest challenges in the world. I'll give you an example: malaria. There is still a lot of malaria around the world, but why have childhood deaths been cut in half in the last 30 years? Two reasons. Vaccines, a huge consortium came together to get childhood vaccines out, and malaria bed nets. And I've been to countries like Zambia. You think, oh my gosh, could you really get a bed net out to a family in a rural, remote part of Zambia? Yes. And it's because of that consortium coming together at the global level. But I sat with the consortium in country of the private sector saying, here are the things we learned about how to get our employees to use bed nets. And I sat with the people who did not just the procurement, but the distribution, and said, they can't sit in the port. We've got to get them out. I sat with the people that civil society said, is it getting out to everyone? We sat with government. So it's when all those people come together to work on a difficult problem and look at it from their own unique perspective and listen to one another that you can actually move forward on these very hard issues.
There's a quote that I love you said many, many years ago, talking about change and the power that we all hold. You said, a woman with a voice is by definition a strong woman. But you also said that the search to find that voice can be remarkably difficult. This year, we've seen an incredible opportunity for people all over the world to think about how they use their voice, how they use their power, and deploy it in different ways to solve for some of these longstanding challenges and difficulties. Can you share one piece of advice you've learned around how you've developed your own voice, and how people in this moment in time can think differently about deploying their voice and the influence they have to be a force for progress?
Well, I'd say first, you have to learn to have your voice in your home. If you don't see equality in your own home, it's very hard to live out in the world. So if you feel like you're doing more than your fair share of the unpaid labor, you better figure that out with your partner in your home or with your kids to take on some of the labor. Then I would say, look, surround yourself with other people who see you for your true self and help you with your voice, help you get it out in the world. And third, I would say, look at some of these new platforms. One of the things I've been so impressed by in the last year, and particularly as we're all locked in our homes, is these social media platforms and how young people are using it to bring pressure on issues and to bring enlightenment on issues and say, we care about this. We want our leaders to do something about it. So I think there are lots of ways now to get out your voice that just weren't even there 5 years ago. And I encourage everybody to look at those and to use those platforms.
As we wrap up, one last question for you. So much of the work that you have dedicated your life to is around expanding women's power and influence. As you look at the work that you've done, you look at your own voice, and given the extraordinary people that you and leaders and people across all the countries that you've worked with and on the issues that you've tackled, how at this moment in time do you define power?
I define power as using your voice and your resources to change the world for others, and particularly in a time of crisis. And so sometimes that means you have a small amount of resources, but wow, you are putting it your shoulder against an issue, or you're voicing that issue. Sometimes you're the head of a country like Angela Merkel, and she's got a lot of resources to bring to bear, but she's also using her voice and her example about how they tackled COVID in Germany as an example for others around the world. So to me, that's what being a female leader, an empowered leader, looks like.
Well, Melinda, thank you so much for the insights today. I was thinking about our conversation this morning, and this memory came up when I met you as a child. I met you very, very young when you came to a Forbes event. And I remember my mother said, go introduce yourself to Mr. and Mrs. Gates. And I was such a shy child. I don't know if why it stood out so much in my mind. But I couldn't believe, thinking back to that memory and at this moment in time, the debt of gratitude I have for the work that you do. Never could I have ever imagined that young self would ever have been so inspired and grateful to the work that you're doing. And this is a sentiment that all of us share. The world is a better place because of you. And in a moment like this, and in this defining time, we are truly so lucky to have a force for change and such a courageous and powerful leader in yourself and in the work that you do to empower so many of us. So thank you so much, Melinda, for being here today.
Well, thanks for that huge compliment, Moira. And thanks for what you're doing to use your platform to get so many of these issues out there. I really, really appreciate it. So good luck with the summit.
Thank you. Thank you, Melinda. And be safe and be well.
You too.